left a 15-year-old girl from Georgia with very few answers for the constant debilitating pain that she lived with.
That is until her family made contact with a world-renowned transplant surgeon here in Madison at UW Hospital. As Dave Delosier tells us, that surgeon removed her kidney and then transplanted it back into her in a different spot. Incredible, Dave.
Yes, Susan, you know, as unusual as that sounds, that is exactly what Dr. Sollinger did. He is one of only a few doctors in the world that has ever treated this unusual syndrome, and had this 15-year-old girl from Georgia not found Dr. Sollinger, she very likely would have lost her kidney, and she may have even lost her life.
She's always been very active.
From gymnastics to cheerleading, nothing slowed Emily Young down until a day she'll never forget.
December 4th, 2014.
A pain first diagnosed as a pulled muscle in her back that didn't go away.
Then the pain started getting worse, and we realized, wow, this is a big deal.
Doctors in Georgia traced the pain to her kidneys, but were unsure of how to treat it. Hoping it would relieve the pain, a stent was placed in the vein going to her kidney. When the stent ruptured, her situation went from bad to worse. From their home in Georgia, the family sought help from doctors across the country.
I've seen more doctors than a kid should ever have to see.
Running out of options, the family heard about a doctor at UW Health.
I emailed Dr. Sollinger, and he emailed me back that night and said we can help her.
Loin pain hematuria syndrome has been estimated 300 to 400 people in the world.
Dr. Sollinger believed that's what Emily had. He is one of very few doctors in the world who have treated it, a treatment that, at its best, is unusual.
They said what they were going to do. I was kind of confused. I was like, oh, how is this going to work? How can you just take a kidney out and move it?
But that is exactly what Dr. Sollinger and a transplant team did. For 4 hours, they worked to remove Emily's kidney, remove the ruptured stent from the vein, and then transplant the kidney back into her in a different spot.
And by doing that, you have totally interrupted the nerve supply.
I was like, wow, I feel so much better. And right after surgery, I didn't have any of the kidney pain that I had had for the past 2 years.
Now, just weeks removed from the surgery, Emily has her life back and a future guided by the man who changed it.
I want to go to med school, and I want to be a transplant surgeon because it's interested me so much.
When you do something that good in such a young patient, and she has such a remarkable recovery, that feels good.
What a wonderful outcome there. Now, the other unusual treatment for loin pain hematuria syndrome is that patients are prescribed Cialis. And the reason for that is the syndrome causes the ureter to spasm, causing pain. Cialis reduces that spasm, thereby eliminating the pain. And Eric, all of this, while it may be a unique treatment, is also a life-changing life-changing for patients like Emily.
Yeah, very impressive surgeon and impressive young lady as well.
Yes.
We wish her well. It is something.
An incredible story.
That's great.
Like, you just think of the family. They said, we're going to take your kidney out, and then we're going to give you Cialis. At 16.
Yeah, you wouldn't expect that.
It's incredible.
It all
Incredible
worked.
story. It all worked. Happy ending. Thanks, Dave. The world's largest gathering of